Periodontitis, commonly known as gum disease, is a chronic inflammatory disorder that affects the periodontium, or the supporting apparatus of the tooth, and manifests itself with a number of problems not only at the oral level, but with potential repercussions on the entire body. Periodontitis is the leading cause of tooth loss in adulthood, and, if not properly treated, can lead to serious complications, not only orally but also systemically. The term periodontitis is derived from the Greek words para, around, and odontos, tooth, and indicates inflammation affecting the tissues that surround and support the tooth: gingiva, root cementum, periodontal ligament, and alveolar bone. The main culprit of periodontitis is the bacterial film plaque that constantly forms on the surface of the teeth. If not removed adequately through proper oral hygiene, these bacteria can result in a chronic inflammatory response, leading first to gingivitis and, in the absence of intervention, progressing to periodontitis. The latter is characterized by destruction of the supporting tissues of the tooth and, in advanced stages, can result in the formation of periodontal pockets, which are spaces that are created between the gum and the tooth, which open up, allowing bacterial growth. The first tangible problems related to periodontitis are bleeding of the gums, followed by halitosis, increased tooth sensitivity and mobility. When periodontal inflammation advances unchecked, it results in progressive loss of the alveolar bone that supports the teeth, causing a weakening of the structures that anchor them. As the disease progresses, gingival retraction can become evident, exposing the tooth root. This not only compromises the aesthetics of the smile, but can also cause dentinal hypersensitivity. In addition, tooth loss can alter the distribution of masticatory forces, leading to occlusion problems and abnormal wear of remaining teeth. Periodontitis, being a chronic inflammatory disease, can contribute to the presence and maintenance of low-grade systemic inflammation. These go by the name of low-grade inflammation. Numerous studies have associated periodontitis with conditions such as cardiovascular disease, diabetes, respiratory disease, and even an increased risk of preterm birth. The bacteria responsible for periodontitis can enter the bloodstream through infected gum pockets, causing distant inflammation. This can lead to the formation of atherosclerotic plaques in blood vessels and increase the risk of heart and cerebrovascular disease. Chronic inflammation related to periodontitis can impair glycemic control, making it more difficult to manage diabetes. At the same time, diabetics are more susceptible to periodontitis, creating a vicious cycle of interaction between the two conditions. Bacteria in the oral cavity can be aspirated into the respiratory tract, contributing to the development or exacerbation of respiratory diseases such as chronic obstructive pulmonary disease and pneumonia. Periodontitis has been associated with an increased risk of preterm birth and low birth weight. It is believed that systemic inflammation and entry of bacteria into the bloodstream may have an effect on pregnancy and difficulty in conception. In addition to medical complications, periodontitis can adversely affect an individual's quality of life, from reduced chewing function to the onset of pain and discomfort, not to mention the psychological impact related to oral aesthetics and halitosis. The repercussions of this disease are profound. For an experienced dental practice like Iuorio Odontoiatri in Aversa, it is important to communicate the issues arising from this disease, as patient awareness is the first step toward prevention and management of the disease.